Every story has a hero, but in this one, it will take 15 frames to find them. At first, you won't see it. By the third frame, you will start to notice. By the 7th, you will begin to wonder. And by the 12th, you will say, there it is. Watch until the end to find the answer.
Red Cross uniforms against a bright wall. A whole team stands ready, faces calm but focused. Before wards and charts, there is belonging. The moment a group promises to carry each other through long nights of need and noise. A quiet briefing before rounds. One nurse holds notes while others listen, sleeves already rolled. Plans, not panic, shape these days. Good care starts in this small circle where questions turn into steps everyone can follow. Sunlit clinic, open windows, gentle voices. A nurse greets an older patient while a colleague observes the hands. Paper becomes care here. Names into needs, needs into actions. The room is simple. The attention feels rich and present. Therapy room under warm paint. A patient stretches while two nurses set bands and dials, reading the body's limits carefully. Healing is practice, not a single moment. Muscles learn again when patience counts louder than any machine. A cheerful canteen window, stacked boxes and a steady ledger. Small purchases become big support. Coffee, soap, letters, bandages. In a moment, you'll see where these little exchanges lead when days run long and beds fill quickly. A curious yellow machine, a careful nurse, a seated patient looking ahead. Measured light and measured distance. Someone once designed this hope. Medicine is often ordinary tools used with extraordinary attention, one detail after another. Close work under lamplight. The nurse steadies the head. The doctor steadies the view. The patient steadies the breath. Few words, many signals. Care is a language you speak with eyes, hands, and perfectly slow timing. Night shift softness. A nurse adjusts blankets and posture. Eyes level with the patient's. Recovery needs warmth, water, pain's name, and someone who keeps showing up. Here, routine becomes kindness, hour by hour by hour. Lesson at a small table. Cloths folded, lamps lit, questions welcome. Training makes courage repeatable. When a city relies on nurses, learning never stops. It only changes rooms. From quiet classes to busy corridors and back again. Crowded ward in morning light. Beds line the walls like sentences. Nurses add commas of rest and food. The work is shared, so the weight is shared. A glance from the doorway says, you are not alone. Sterile room, steady hands, careful steps. Masks and aprons turn people into one team, moving around the table like a clock. The peak of effort is quiet here. Precision replaces noise, and hope follows the rhythm. Open air veranda with curtains. At last you see where those small purchases mattered. Fresh linens, warm drinks, time to breathe. The city's care system widens into sunlight, turning narrow nights into places someone can finally rest. Rehabilitation frame above the bed, bright pads and straps. A nurse talks the patient through each movement, shaping pain into progress. Today's inch is tomorrow's walk. Healing is a craft taught in patient hours and hopeful nods. Canvas walls, soft daylight, a nurse leaning close, far from the main ward. Care looks lighter, but never less. One hand supports the cup, while another supports a story that will be told when strength returns. Children's ward at the end of the hall. A woman bends to speak at eye level. The room brightens like a promise. We finish here on purpose, because the future is the reason every shift begins again.
Now you have seen it. The hero was there all along, not in the spotlight, but in every quiet act of care. Sometimes the greatest stories are the ones we always overlook.